Good evening and welcome to our home. My name is Dr. Timothy Quinn, and I am very excited to speak with you all today about cardiovascular disease. Cardiovascular disease is the number one killer of Americans to date, and a lot of it has to do with individuals that might have hypertension, they might have diabetes, or other chronic medical conditions that are not properly treated. Because cardiovascular disease, which can result in strokes and heart attacks, in a lot of cases can be avoided. So you might ask, how can I do this? Well, the first thing you want to look at is the fact that cardiovascular disease is multifactorial as far as the cause. Multiple factors contribute to someone suffering a stroke or heart attack or other complications of cardiovascular disease that can be deadly. Now, let's talk about one of the factors that we cannot control. That's a person's genetics. Now, last night I watched the Super Bowl. It was great. My wife and I, we just had a little couple party together, just she and myself, and we made some crab legs and we watched the game. And in the game, a lot of the players there in the Super Bowl, of course, were great athletes. Actually, all of the players were great athletes. But I remember in my studies in undergrad and in med school, we talked about genetics and the fact that a lot of individuals that make it to the level of the professional football league, if you study their family history, a lot of them probably were athletes. A lot of the professional athletes, parents, maybe their father was a professional football player or professional basketball player. Maybe their mom played volleyball. She was really good. She may have played softball, but genetics are real. And there's not a whole lot you can do about your genetic predisposition other than, just live. So, as far as your genetics, one thing you want to do is you want to know your family history. And you want to share this with your medical provider when you visit them. So if you had an uncle that died of a heart attack at a very early age, say 45 or even 55, you want to share that because that's relevant. Or if you had a parent, a mother or a father that had a serious stroke or heart attack at an early age, you want to let the doctor know because these are things that we will take into consideration and maybe be a little more aggressive with some of the other factors that can contribute to cardiovascular disease and how it manifests for that individual person. So genetics, I can't really talk a lot about because other than just knowing your family history and reporting that to your medical provider, that's all you can really do on that one. Let's talk about another factor that's very, very important, and that's your lifestyle because you can do something about your lifestyle. Now, let's hypothetically say that you're a person that has genetics that are predisposition to have severe cardiovascular disease. Maybe you were diagnosed with hypertension in your 20s, which happens. Even we have some that are diagnosed with hypertension in their teens. Well, if you change your lifestyle appropriately, then you can drastically impact your genetic predisposition. So the question is, what can you do, right? Well, exercise and eat healthy. These things are very, very, very effective. Also, if you have chronic medical conditions, okay, that's another factor that we want to talk about today or tonight because it is nighttime, but you'll be watching it during the day. Um, your chronic medical condition. So let's hypothetically say you do have hypertension. Okay, you've been diagnosed, you've been prescribed medication, you got to take the medication. You got to follow up with your medical provider at the intervals that he or she feels are appropriate for your medical care, and you got to follow the directions. We have a lot of patients that, we might see them, blood pressure is very high. We start blood pressure medicine after a trial of diet and exercise didn't quite work, so we'll start the blood pressure medication, and then you might not see them for a while. Maybe you see them at Kroger. Hey, doc, how's it going? I'm like, John, you must have a new doctor now. No, doc, I just decided I didn't need the medicine because I feel fine. No, that's a bad answer. And the reason for that is you can't really rely on how you feel in regard to the status of your cardiovascular disease. You got to follow up with your medical provider. And if they advise you to take medicine, take it. Now, it is possible that if your lifestyle is very, very good, as far as you start exercising very effectively, you start eating more healthy, then sometimes we can get some of the medicines down. But at the same time, you have to maintain compliance and work with your medical provider. Now, let's go back to lifestyle because that's something that we can really, really have a big impact on. And I just want to share a story about a patient that I love telling this story because it sort of puts things into perspective. And you might think, what do you mean by that? Put things into perspective. Well, this particular patient was someone that was living with obesity. She was very overweight. She, just to kind of put it into perspective, she wore a dress size that was like a 22 dress size. Okay, she was someone living with obesity. And I would talk to her about getting her weight down. I'd advise her, hey, you want to be in our walking program that we had? Do you want to be in our diet program? Because we always have something going on at our clinic of Quinn Healthcare. But she never showed any interest. And all of her medical conditions were very poorly controlled. She had diabetes and she was on two forms of insulin, short acting and long acting, and three diabetic pills. Not much success. She also was on four blood pressure pills, a cholesterol pill. She was on a pill for depression and anxiety, and she was on pills for her joints because her joints hurt very bad. But we had to pull that back because her kidneys were starting to have problems with all that medication and uncontrolled diabetes and hypertension. Well, the deal is, one day she came into the clinic and she was very, very excited. And I had never seen her like that before because normally she had a very flat affect. She never made eye contact with me. She basically was very silent at all times, but she was very chatty. And I remember so well, I walked in the room and the first thing she told me was, Doc, I'm going to get my dream husband. And I'm like, who are you? I thought it was in the Twilight Zone. But long story short, she showed me her Facebook page. And there was a gentleman on there, a good looking guy. And she explained that she and he went to high school together. And she always had the biggest crush on him. But for some reason, they never connected. But she learned that he had just gone through a divorce. And her high school reunion, I think it was her 20-year reunion, was going to be in about 10 months. And she said, Doc, I really believe that he and I, we're going to get together now. Now that he got rid of that lady, I'm like, okay, we're not going to be happy about his divorce, but we are going to be happy that you're optimistic about something because we wanted her to be optimistic. But being the guy I am, I'm always looking for some kind of deal going on. I saw an opportunity and I asked her, I said, well, since you're going to that reunion, it wouldn't be a bad idea if we started talking about getting to a healthier weight. It couldn't hurt. Maybe you could get into a different dress size. And I don't know, get on the dance floor and just woo them away. So she was like, Doc, I am interested now. So I knew she was going to say that. So basically, we started our program and we monitored her very closely, where she would have to text every day to let us know what she ate and how far she exercised. She went out and bought some walking shoes that same day, and she had to take a picture of her shoes on the concrete to show us that she started. And it was good. We would follow her every day with the text, and we would call every week. We chat. She'd come in every month, and we do different blood pressure checks, check her blood glucose, and we had to start peeling her back from her medication. We stopped the short acting insulin. We kept going less and less and less and less. No more short acting because her blood glucose was going too low. Then we're able to stop the long acting insulin and stop one of the pills. As far as the blood pressure medicine, for the first time, her blood pressure was getting controlled. So we were able to peel back some of the blood pressure medicine. But over the course of 10 months, we were able to stop all of the insulin. And she was only on 2 pills for diabetes. She was only on 2 pills for blood pressure. Initially, she was on 4. Cholesterol, she was on 1 pill, but it was well controlled. And as far as her joint pain, it was almost gone. She didn't even need the joint pain medicine anymore. And to put the cherry on top, the medicine for anxiety, which was Zoloft, she didn't need that anymore either for anxiety and depression. She was happy. She was optimistic. She was looking forward to something. And she was at a healthier weight. So I remember the last time she came in before the reunion. She came into the clinic and I walked in the room and she was all dressed up with some shiny looking clothes and she just did like this. I heard it. Whoa. I said, wow, you look good, girl. And I said, your hair. And she said, I paid for it. I said, that's right, you did. And it was some beautiful hair. But the deal is, she was really, really excited. And we coached her. My nurse, one of my nurses, she was like her sister girl coach, and we talked about what she was gonna wear on each night because she bought the itinerary. Well, the reunion happened. And we were so excited. We called her, no answer, no text, no responses. And a week went by. So I asked my nurse, I said, let's get her on the phone. We kept trying, but she finally called me back. And the first thing she said was, Dr. Quinn, I'm a big fat loser. I was like, what are you talking about? I said, girl, you the baddest lady in the world. I mean, you killed it. I know you did. And she said, she told me that he laughed at her. I said, well, here's the deal. You dodged a jerk. That's right. You dodged a jerk. Because the deal with him was he couldn't see a beautiful woman right in front of him. He didn't deserve you anyway. And that's probably why his wife left him. But there's another guy for you. All right. There's another guy because you are a winner. And we looked at everything. She went from a size 22 dress size all the way down to, I want to say, a 14, 16, somewhere in there. That's a big difference. She got off of all the insulin. Blood pressure was finally controlled. Note that her diabetes initially, although she was on all that medicine, it was poorly controlled. Her A1C was severely high, greater than 12. Now her A1C was like 7, which is good. No more depression, no more. I told you, you are a winner because you're healthier. And that's what it's all about. When you want to change your lifestyle, you have to have goals that are the best for you as an individual. She probably wasn't going to get down to a 6. Maybe she didn't need to get down to a 6 because that might have been small for her. But when you're trying to make lifestyle changes, you have to understand that you didn't get in the shape you are overnight. It took years to get into that shape, and it'll take years to get back to the shape you want to get to. And you never may get to the perfect shape. But what you want to do is you want to be the best version of yourself because you deserve it. And also, you want to be healthier because at the end of the game, at the end of the day, at the end of the game, that's the objective, to be healthier. Because if you have a genetic predisposition for cardiovascular disease, to have that stroke at 55, if you make those changes, there's so much less chance that you'll have that stroke. And if you do have that stroke, you can push it back 20 years. All right. So these are the things you want to do. Now, we talked about lifestyle changes. We talked about being compliant, taking your medication, doing everything you can do to get to that healthier state of health. But also, I just want to end by talking about a new class of medications. These medications are the GLP-1 agonists. Okay, and basically, these medications were initially started for diabetes. You've probably heard of Ozempic. That's the most popular one. The generic is semaglutide. Well, people that were using this medicine for diabetes and getting a lot better, they worked very well, they were losing weight. So what the company did, Novo Nordisk, is they did clinical trials and they got the clinical indication with the FDA for weight loss. And the newest medicine now is Wegovy. It is very, very effective. It's the generic semaglutide at 2.4 milligrams, a higher dose, but it's an injection once a week and it works. Now, you might ask, how does it work? Well, what it does is it mimics hormones within your body, a very um, common hormone that's released from your GI tract. But what it does is it slows GI emptying, meaning when you eat, you get full much more quickly. So if you're somebody that goes to Subway and gets a sick, let's say you get a 12-inch and you're full after you eat that 12-inch, if you use this medication, you might eat maybe one half or less of the 6-inch and you're full, so you stop eating. But the result is you lose weight. But these medicines also, they work with your brain, your hypothalamus specifically, with these centers that cause you to get very hungry and they cause you to get less hungry, but also they speed up your metabolism a little bit. And basically, what they're doing is they're combating something called metabolic adaptation. Now, what is metabolic adaptation? That's a big word. Basically, if you're somebody that is exercising, you're eating healthy, you're doing everything right, but you notice you're losing weight, but you start plateauing, and then you might start gaining it back. What that is that's your body's autoregulatory system trying to get you back to where you were, because your brain and your body systems, to include your nervous system, they think that you're starving. So they release hormones at a different level to make you very hungry. So you'll eat more. Your metabolism slows down so you won't lose that weight and you'll get back to your beginning weight. And that's what happens to a lot of people. That's why I tell a lot of people, when you're trying to get to a healthier weight, there are a lot of things working against you. But also, you want to talk to your medical doctor about getting evaluated for problems with your hormones. Some people have low um, testosterone. Some people can have low thyroid hormone, different hormonal imbalances. And then there are other things that can contribute. But that metabolic adaptation, it can actually be remedied by considering these new medications that are very good. So I just wanted to share that with you, but also encourage you, because if you have the genetic predisposition to have cardiovascular disease at a younger age, unfortunately, or any age, you can fight back. And the way you fight back, like I said, is number one, know your family history and discuss that with your medical doctor or nurse practitioner or PA, so they can be empowered with the knowledge so they can act accordingly, so that they can work, as far as if you have a family history that's not favorable. The second thing you can do is maintain compliance with your treatment regimen of your medical provider. If they say, I need you to see the cardiologist, go to your appointment and don't be like, well, it'll be okay. I'm not going to go. No, go. If they say, take your medicine, take your medicine. If they say, come see me every 3 months, go every 3 months, or whatever interval that they think is best for your medical plan. And then lastly, lifestyle, lifestyle, lifestyle. Eat healthy, exercise, and consider some type of structured workout exercise program, also a structured dietary regimen. And lastly, just want to note, and there's no diet that's perfect for everybody. Find something that works for you, something that's sustainable, long term, and you'll find more success. And as I said, a structured weight loss program, as far as exercise, would be like my wife and I, we work out with the Peloton and we follow their instruction, but it's more motivational because it's almost like a group exercise. But there's so many things you can do, but just know that you don't have to just wait for cardiovascular disease. You can fight back. My name is Dr. Timothy Quinn, and my ringer just went off. And I thank you for coming into my home and let me just encourage you to be the best version of yourself that you deserve to be.